Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today we are going to compare the wound of entry and the exit. Wound of entry as well as the exit. So let's begin with the wound of entry. Wound of entry is basically smaller in the diameter than of the bullet, whereas the wound of exit is large. So entry, you can call it is smaller. Entry is usually smaller and then the exit is going to be larger. This is how basically it is. And in close discharge, the skin is torn and hence the size is increased. So in terms of its being close, it will be the skin is torn and the size is likely to be increased. So all this is concerned with the entry wound. Next will be the margins. So what about the margins? The margins will be inverted. This is in case of the entry wound. Entry wound, it is going to be inverted. Then comes the soiling of wound. So all these points are going to be positive. The soiling of wound, the abrasion collar, the contusion collar, the grease collar. So all the named collars, they are going to be positive. This is in terms of the entry wound. Next is, what about the bleeding? The bleeding is going to be very significantly less because of the entry wound. Because of the exit wound, as it passes through various structures, it is going to be more. So bleeding, this is basic. So bleeding is going to be minimal. So in terms of the entry wound, it is going to be minimal. It is going to be less. Then, when we look at the foreign bodies, the foreign bodies is going to be present. In terms of wound of entry, the foreign bodies are present and the disposition of the pellets, that is also present, and the protrusion of the fat. So protrusion of fat is positive. So the positive is again in the case of the entry wound. Next is looking at the bright red. So bright red is present. This is nothing but the carboxyhemoglobin. So bright red spot is again positive. This is in case of the entry wound. Next is the X-ray metallic ring. So this is again positive. So what we are saying is there is so many positives in case of the entry wound. So the X-ray metallic ring is positive. The muzzle impression is going to be positive. So muzzle impression, this will again be positive. And then the blast effect. The blast effect will also be positive. So let's write it down. The blast effect. The blast effect is again going to be positive. This is in case of again the entry wound. To learn and grow daily like this, please do subscribe.